could you please explain what is blood pressure and what the higher number and the lower number of the blood pressure denotes to?
Yeah, that's called as systolic and diastolic. Blood pressure is simply the pressure generated in your blood vessels. Our heart is like a pump. So it's just the size of a small fist, the closed fist, and it beats without any break for 70 to 80 times in a minute. So the pressure which it generates during contraction is called systolic blood pressure. The heart contracts and relaxes. So when it contracts, it pumps blood to the various organs of our body, and that is the systolic blood pressure, which ideally should be below 120. That's what the latest guidelines say. And the diastolic pressure is between two heartbeats. So when the heart is relaxed, and that should be below 80. Those are ideal values, but you should aim to have somewhere between 130 and 80. For all practical purposes, I would say anything between 130 and 80 would be acceptable. But hypertension, when you define it, anything above 140 or above and 90 or above. So 140 above is systolic and 90 plus is diastolic. Anything above that, it is hypertension.
Is it possible that a person can have a normal diastolic pressure but a higher systolic numbers and vice versa? And if yes, what is the reason, sir?
It is called isolated systolic hypertension. It is common in older women in some cases, and that also is an equally important risk factor for complications. So it has to be treated, and it can be treated.
And what is the line of treatment?
The same measures what you do for a otherwise hypertensive patient. You have to restrict your salt content, you have to be physically active, you have to eat the right kind of diet, and you have to keep monitoring yourself and take medications regularly if indicated, not to stop them on your own.